Hello everyone, this is Dr. Karatas. We're back together with the first video of 2019. On this occasion, I wish for 2019 to be healthy, peaceful, and happy for everyone. Now, we previously talked about PRP and PSHAT therapy. In cases of erectile dysfunction, Peyronie's disease, and penis enlargement, we were using this, and recently SVF, that is stomovascular fraction, or FAT. I was talking about tissue-derived regenerative cell therapy, commonly known as stem cell therapy, in erectile dysfunction and Peyronie's disease. A few of our subscribers, a few of our friends asked, can you explain the differences between these two? He said, I really hadn't thought of that. I want to thank them from here. There are really important differences between the two. I will try to explain these briefly. Now, left side, you see PRP, and right side PRP. On this side, you will see the stem cell. Now, three of them, there are important differences, many of them, but we will examine them one by one. Now, PRP is applied by activating the platelets we take from the blood and injecting them into the penis. The target is vascular, meaning the new vascular formation, which we call angiogenesis. Stem cells are derived from fat or bone marrow. The cells we obtain from there are progenitor cells, and they have an effect on the entire structure, meaning the entire skeleton of the penis. Now, I will bring two diagrams to understand this. Now, here's how it's done. I had explained PRP and PSHAT before, so I will go through this quickly. We take blood and we centrifuge it for about 8 to 10 minutes. A very thin layer of platelets was forming there. We activate these platelets, which are the clotting cells. Then we inject it into the penis. This process takes about half an hour. It takes about half an hour to 40 minutes. A more detailed treatment for stem cell therapy. First, we obtain fat. Generally, we obtain fat from the side or the belly area in men. This process takes about half an hour. After that, we pass them through a special enzymatic reaction. This process takes about 2 to 2.5 hours. In the end, we obtain these cells. We inject these cells we obtained into the penis. The total duration of this procedure takes about 4 hours. So, what is our goal here? There is a fundamental difference between the two. Let me try to explain right away. I hope I can explain it, because it's a topic that's hard to understand and explain. Now, in PRP, that is in the PSHAT, our goal is to extract and to take the clotting cells, which we call thrombocytes. Why are we extracting the clotting cells? Let me explain it this way. When we get a cut, the clotting cells go there and perform two functions. The first function is to try to stop the bleeding immediately if there is any bleeding. The second one is, after stopping the bleeding, it releases a number of factors. It sends out a number of signals. And it ensures the repair of the muscles, blood vessels, existing muscles, existing blood vessels, and existing nerves in that area. So the cut is being repaired. The blood vessels, nerves, and muscles are being repaired there. That's our goal with PRP and PSHAT. When we take the platelets and activate them, before injecting them into the penis, we enable the cells there to repair themselves. In stem cell therapy, the situation is, or in SVF, the situation is completely different. Here, we are not trying to repair our own cells. These cells, that is, it's sourced from fat. Pioneer cells, we inject muscle precursor cells and vascular precursor cells into the penis. So here, it's not really about repair, but rather a state of regeneration, which we refer to as renewal. In PRP, the signals that come from platelets, while we are repairing our existing cells, we are actually introducing new cells in here. These all provide renewal. The main difference between the two is this. That's why the treatments are quite different from each other. So, how is PRP applied? It is recommended to have at least 3 sessions. Every 1 to 3 months. It's not done every day or even once a week. Every 1 to 3 months. Sometimes they do 1. In some places they do 2, and in some places they do 3. It varies on severity of patient. Stem cell treatment is applied in a single session. The effect of PRP and PSHAT lasts about 1 to 2 months, which is around 4 to 8 weeks. We do it and then we check. In the treatment with stem cells, in CVP treatment, we have a waiting period of 6 to 12 months. But usually within 6 months, we can get the results. Generally, shock. PRP is done together with P-shot shockwave, so it's done in addition to the shockwave. Stem cell treatment can be done on its own, but if we apply shockwave therapy afterwards, it's said that we can stimulate the stem cells here more quickly, so we can get results earlier. That's how we do it as well. PRP treatment, P-shot therapy with shockwave, is more mild. When applying stem cell and shockwave therapy to patients with moderate complaints, we tend to use the shockwave treatment more for those with moderate to severe erectile dysfunction complaints. So these are the main differences between the two. I hope I was able to explain it. It's a tough topic, but of course, as we can understand from here, from Kokuju treatment, TRF treatment, PEP, and P-shot treatment, it's a much more advanced and much newer treatment. Thank you.